Good afternoon, and welcome to today's Facebook Live event. I'm your host, Reese, with nona.media, and today we are kicking off a roundtable discussion about the Lake Nona Life Project. The Lake Nona Life Project seeks to crack the code on lifelong health, helping Lake Nona and future generations live healthier lives and serve as a global model for well-being. The Life Project is a community-based health research study that seeks to gather data through a survey from Lake Nona residents, employees, students, and visitors who frequently come to enjoy the social atmosphere. And I am joined today here by Dr. Elsa Stearn, who is the medical director at Tavistock Development Company and the Lake Nona Institute. Dr. Stearn, can you tell us about your role at Tavistock and how you came to be involved with the Life Project?
Hi, sure. Thank you for having me. So I joined in November in the role of medical director for Tavistock and the Lake Nona Institute, with the goal to help support Lake Nona's mission, which is to promote health and well-being and to optimize human potential. I think a lot of people, when they initially meet me, are maybe a little confused as to why a development company needs a medical director. But this is not a typical development company, and this is not a typical community. So I think the Life Project is one really fantastic example of that. In terms of why this is important to me and why I wanted to get involved more directly, I think that has a lot to do with my background and my training. So I have a degree in public health, where I focused on behavioral science and health education, which has always been a priority for me. And I'm also an internal medicine physician. So I worked as a hospitalist in some of the largest urban hospitals with a lot of underinsured and uninsured patients. So I've kind of seen firsthand the pathology that can happen when people aren't focused on their health and their well-being. So, the key really is to prevent disease before it happens. And that's how we can make the biggest impact. And that's why the Life Project is so important. In fact, I can't really think of any community in America right now where the residents have an opportunity like this to participate in a study that evaluates whole person health and follows them forward over time. So to me, it's a really unique and exciting opportunity. And so I was really excited when Patricia and the team asked me to join the research team as a co-investigator.
Outstanding. Thank you so much for that. Also joining us today, I have Dr. Patricia Robinson, who is the Scientific Director of Nursing, Population Health, and Academic Research at AdventHealth Research Institute. Dr. Robinson, tell us about your role at AdventHealth and your role as Principal Investigator for the Life Project, please.
Sure. First of all, thanks for providing us this forum. We appreciate it. My role at AdventHealth is I have been a research leader there for the past 12 years. 5 years ago, I was handed the opportunity by my leadership to create a team of research scientists that would focus on whole person health instead of just on physical health. I think that health systems tend to focus on physical health because that's what we do as our day job. When you think about it, what Dr. Silverstein was referring to is it's our behaviors and our choices and our life circumstances that lead to that physical health, whether it maintains it or whether it erodes it. The life study is all about figuring those things out. It's about following people through times and watching both their behavior and their health. I am a scientist by background, so you have a physician and a nurse leading this out.
Perfect. Thank you so much for that. We are also joined by Mike Foote, who is a resident of Lake Nona. Mike, can you tell us how long you've been living in Lake Nona and kind of what you enjoy most about living here, and also what attracted you to the project?
Sure. Yeah, thanks, Reese. Glad to be here today. We have been here about 5.5 years in the Lake Nona Laureate Park area. I'm here with my wife, Natalia, and my two boys, Jacob and Charlie. They both attend Laureate Park Elementary. And what initially drew us to the community was the amenities. And 5.5 years ago, we definitely didn't have what we have today. And 5 years from now, we'll still have more. So it's been an awesome opportunity to watch a community grow and see all that's going on. The Foote household is definitely passionate about health and wellness, meditation, exercise, nutrition, all of that. So, when we first heard about the Lake Nona Life Project, we knew we wanted to be a part of it, and we have been for a while. A funny story is I was looking through some of the emails, and I actually saw the initial Lake Nona Life Project email invite, and that was on May 13th of 2014. So I've been a part of the Lake Nona Life Project and just had my 6-year anniversary. So glad to be here again.
Thanks for being here. I appreciate it, and happy anniversary. And finally, we have joining us today Maria Esham, who is also a resident of Lake Nona. Maria, can you tell us how long you've been a resident here in Lake Nona what you like about Lake Nona and attracted you here, and what attracted you to the Life Project.
Well, I've been part of Lake Nona since 1999, as I was given the opportunity to open the Lake Nona YMCA. So I have seen the community grown for the last 20 years. And, you know, it made sense for us to be part of the community and also live here. So about 6 years ago, we also moved to Laurier Park, and is me and my husband and our son, William, and a big dog named Hudson. So been in the fitness industry for many years, but also been part of the Tavistock group for the last 13 years, holding different positions there, and now oversee their fitness department in the country club. So fitness has been part of my life. And then the Lake Nona Life Project just kind of seemed to definitely something that we needed to be part of, and looking to see what the study finds, and hopefully encourage others to be part of it. So we're excited to be part of this.
Outstanding. Thank you so much. And thank you all for joining us. I would like to let the audience know to please keep in mind that this is considered an open forum. Any information you have received here should not replace medical advice. You should always refer to your doctor first if you have specific questions about your health. To the audience, thank you all for joining us today. We are so happy to have you. If you have a question for the panel, please type it into the comments below, and we will try to answer as many questions as we can today. Today, our topic is cracking the code on lifelong health and how this important research is being done right here in our community through the Lake Nona Life Project. To that end, I would like to kick it off with a video about the Life Project. So we're going to go ahead and roll that video.
Right now, Lake Nona is writing its own life story, starting with people in our own community whose small steps here are leading to profound changes throughout our world. Welcome to the Lake Nona Life Project, a long-term health study investigating the lifestyle behaviors that optimize well-being. And you're already a part of it because you've made Lake Nona's well-being community your home.
I got involved with the Lake Nona Life Project because I feel like it's important as a member of this community to give back and also learn more about, health research and how it impacts our community.
The more I learned about it, it seems even more interesting because it's going to take the data and see how living a healthy lifestyle actually does apply towards long-term health benefits.
For us to be a part of it, I think it's a great opportunity for us as a family.
It's a pretty ambitious goal, but if you look at this is something that could be considered part of history and could advance medical science.
Some of the greatest medical advances in history have come from community participation. Working with Lake Nona Medical City researchers and partners, the Life Project will be the long-term study that cracks the code to lifelong health and answers the question, what keeps someone well?
I want to be able to identify trends that will allow me to live a happier, longer, healthier life.
I'd like to learn better ways to make sure that I'm doing all I can do for my children, that they are able to live the healthiest lifestyle as well.
This is more than just a life project. It really is a way of life.
World-class researchers are already gaining knowledge that is helping Lake Nona residents live healthier lives.
If we can help Lake Nona come to fruition as the healthiest city, then this is scalable. Then we take it globally, we take it nationally. But this is what our nation needs, a model like this.
The more people we can get involved in it, the more accurate representation we can get about our community.
It's a chance to be part of something that's bigger than yourself.
What we'll learn from the Lake Nona Life Project is going to affect the surrounding areas and maybe the world.
Communities like this throughout the country will be encouraged, and as a result, we'll see lower healthcare costs, we'll see better medicine, we'll see fewer drugs, and healthier, active, fun-loving people.
With your help, we can continue building a brighter future here in our own Lake Nona community and beyond. To be a part of the Lake Nona Life Project, simply go to mylakenonalifeproject.com and click on the Participate tab to complete your survey. Join us today to create a healthier tomorrow.
I'm proud to be part of the Life Project.
I'm making history.
We're making history.
Will you join us?
What an amazing video. So for those of you who are just joining us, I am here with Dr. Elsa Stearn with the Tavistock Development Company and Lake Nona Institute, Dr. Patricia Robinson with the AdventHealth Research Institute, and two residents of Lake Nona, Mike Foote and Maria Esham. We're talking about cracking the code on lifelong health and how research through the Lake Nona Life Project is making an impact here locally. I'm going to kick off the discussion with our first question, and this is I'd like Dr. Robinson to address this. The Lake Nona Life Project, what is this all about, really?
It's about exactly that, life in Lake Nona. The Life Project was the brainchild of behavioral scientists at Johnson & Johnson, who got together with Tavistock to look for things that were unique about the Lake Nona community. Once the first stage of the study was successfully launched, J&J scientists pivoted to new priorities and allowed AdventHealth to come in as the principal sponsors of the Lake Nona Life Project. That gives me, as the principal investigator, the privilege of working with people like Dr. Silverstein and Jay Groves of the Lake Nona Performance Institute. And it's really exciting work that we're doing. To tell you a little bit about AdventHealth and why we're such a good fit for the Life Project, we are the largest healthcare system in the state of Florida, and the 11th largest healthcare system in the country. We have 50 campuses over 9 states, and we invest quite heavily, millions of dollars a year in research and finding out how to keep people whole. So we figured out maybe a year and a half ago that our new brand promise in way of doing business was going to be to try to keep people out of the hospital and keep people as well as we can for as long as we can. I think that hospitals have been really good for a long time of having you live to 80, 90, 100 years old, but 50 or so of those years you carry disease burden with you. What we want to do with this study is study how we can reapply those resources, those healthcare dollars, to keep you healthier till you're much later in your life, to kind of compress disease symptoms to the very end of your life. A lot of people also compare the study to the Framingham study, and it is indeed the same in that it's a longitudinal study over many decades studying the residents of a community. But the fundamental difference is that we're going to give feedback. So the Framingham study studied cardiac health in a community over decades and was able to report back things we could change about how we live to improve our cardiac health. What this is going to do is not wait decades to return information to you. So how you're living as an adult today, we can give you feedback to change the health of your household, to pass on to your kids. It's really about giving you feedback so you see how you're doing compared to the community and how you're doing compared to the nation. That's why we do the study every 2 years, so we can see as you start to veer a little off course and kind of nudge you back with some helpful hints.
Outstanding, thank you for that. And kind of along those lines, you mentioned, the medical impact. Why is this work believed to be important from a medical standpoint? Dr. Silverstein, can you address that?
On well populations and how do we actually keep people well. I think one of the few examples and the ones that we often reference is the Framingham heart study, which we were just talking about, and that still is most of the risk factors for heart disease that we've learned and in use today we learned from that study. More recently, as an example, there's been a lot of interest in the medical community about the association between lifestyle factors and certain types of cancers or malignancies. So colorectal cancer in particular, we've noticed recently that it's been affecting really young patients in their 20s and 30s, and not exactly sure why that is. And it appears, at least in part, that this might be explained by some lifestyle decisions like obesity and poor diet. And one of the ways that we've learned that is through other longitudinal health studies like the Nurses' Health Study, where they've looked at 85,000 nurses, followed them over time from all the way from 1989 to 2011. And one thing that they saw was that women who were obese had the highest risk of early onset colorectal cancer. In fact, it was twice as likely that women that were obese were to be diagnosed than those that had normal BMI but were not obese. But to be clear, there's also some young, fit, healthy people with no other clear risk factors that are being diagnosed with early onset cancers and colon cancer. So there's obviously more to the story. So we really need to identify what are the big risk factors for these diseases and cancer in general, so that we can develop targeted prevention and detection strategies. And like Patricia said, this is something that we can do real time with this study. So that's what's kind of amazing, and these are the kind of things that we can answer with the Life Project.
Thank you so much for that information. So, what is the significance of following a community in a long-term health study such as this one? Dr. Robinson, can you expand on that?
Sure. I think Tavistock and Lake Nona's interest in this in particular was showing and demonstrating the health value of the perfect built community. So those of us that are in social sciences research will often make assumptions and associations. So we'll talk about things like food deserts or the availability of resources in a community, and we assume that those are the things that matter. Lake Nona has very intentionally built in to provide so many of the elements of a perfect built environment that we really wanted to jump on the chance to study this community for decades so that we could compare those findings with other communities, even in our own community that are underserved, and be able to look at the differences that really do matter and stop making quite as many assumptions. The other really cool part about this is the ability to change things in the community. So if we notice, for instance, that activity is going down community-wide, not just at the individual level over the 4 years or 6 years mark, then we're able to speak to leadership in the Lake Nona community and put interventions in place that will help change that behavior. So again, the difference in this study is that we don't just observe behavior, we're intentionally putting things in place to try to change it to healthier behavior.
Outstanding. Thank you so much for that. That's great information. Now, the study initially started with just including residents and people who work in Lake Nona at its inception. How has that since changed? Dr. Silverstein, can you speak to that?
Yeah, so initially the study was limited to people who lived or worked in Lake Nona, but criteria for who can participate has recently changed and been expanded. So anyone that lives, works, plays, or studies at Lake Nona can now participate. So we're excited about this because we really want to be able to extend this opportunity to the whole community, and that includes, our students at UCF, UF School of Pharmacy, Valencia, as well as all the many people that frequent our restaurants and events. I also think it's particularly interesting because there are many people that both work and play here, or live, work, and play here, including myself. I fall into that category. So being able to capture that data will allow us to understand, is there maybe a dose relationship between the amount of time that people spend in Lake Nona and some of these health outcomes.
That's outstanding. No, thank you for the insight. Now, I'd like to kind of hear from Maria and Mike next. And Maria, if you'll go first, what is a Lake Nona Life Project community champ, and what motivated you to become a community champ?
Well, I just think we have an incredible opportunity to make a difference and hopefully give some sort of insight on what a community like Lake Nona can do to impact people's well-being. And by doing this, future communities and planned communities can integrate some of these findings. So as a whole, we can all be better humans. So to me, being a community ambassador or a champion is hopefully help motivate people to do it, because it really is going to make a big difference and hopefully make an impact on everyone's lives.
Thank you so much. And then Mike, what do you have to offer along this?
Yeah, thanks, Reese. I'd like to just add that as community champs, we really act as a liaison between the community members and the leadership of the study. So if there's ever any questions, comments, or concerns, you can reach out to one of us, and we can relay the message, get the answer that you need. And if you don't know who your community champ is, if you go onto the website, there is a section for the team, and all the community champs are listed under there. And you can go to your neighborhood and look up who your champ is and reach out to any one of us with any questions that you may have.
Great. Thank you so much for that. And so I'd like to kind of check in on what enhancements AdventHealth has made to the survey, and why were those necessary from a research perspective, and how was the data retrieved? Dr. Robinson, can you address that?
Sure. So again, with a focus on whole person care, not just physical health, it went from being a survey that talked a lot about how you move, what you eat, where you play, who you know, those kinds of things. We wanted to add things that we also know are important to the decisions you make around your physical health. So we added sections on things like quality of life, religiosity, spirituality, social networks, pets. There's actually validated studies on the roles of pets in your life now, and they appear to be really important, especially in addressing things like social isolation, which we also now address. Then there's things that we hadn't thought of 5 years ago as ways of harming ourselves, new destructive behaviors like vaping that weren't even on the radar 6 years ago now when Mr. Foote signed up for the study. He didn't know vaping was an option to him, so it wasn't measured within the study. Now it is. So we try to look, we just refresh it every few years to make sure it represents the risks and benefits that still are available.
Outstanding. Thank you for that clarification. And Dr. Silverstein, you mentioned that people that work in Lake Nona can participate in the Life Project. How is the study reaching employers in the Lake Nona community?
Yeah, we want to focus on engaging employers because they really are a major part of our community. In addition, we know that employers are motivated to have a healthy workforce. So we feel it's important to invest in employees' whole person health over time, and participating in the Life Project is a great way to do that. So by taking the survey, employees will recognize earlier if they're falling off the curve, as Patricia mentioned, in any of these areas, and can help nudge them back to health. We decided to start with our employees first at Tavistock, and we've had great success with that. And now we feel like we're ready to reach out to other employers in the area. So in order to try to make it as easy a process as possible, we're going to go on site to conduct virtual or in-person meetings, just to share more information about the Life Project, even supply some engagement tools, and just to try to raise awareness about the Life Project.
Thank you so much. So I want to go back to the champs. And Mike, this time if you'll go first. Why do you think it's important for Lake Nona residents to take part in the Life Project survey?
Well, I think by participating in the survey, we really have the ability to impact many generations to come. Our children, our children's children, and it takes 30 minutes every other year to do the survey, and the information gained can be super impactful. And not only for our kids and future generations, but for ourselves, like Dr. Robinson mentioned, interventions that can be done as certain things start to come to light as maybe not fully there in a neighborhood. So we can really focus on sleep or stress. And if you answer the survey a certain way, you might qualify for a sub-study, and that could help you out in those different areas. So I think it's just both for yourself and for future generations, it's a huge benefit.
Outstanding. Thank you so much, Mike. And Maria, can you add your perspective on that?
Yeah, very similar to what Mike expressed. It not only can benefit the community as a whole and future generations, but there's nice perks to participate. It could definitely make you look within you and see what areas you need to improve and within your own family. And so it really helps to stay focused and continue to maintain a healthy lifestyle and stay on track.
Thank you so much. So we did have some questions from the audience that I wanted to bring up. There's, on typical of today's information age, there's always concern about information security. So what is the status of how secure information is with the project? Dr. Robinson.
Yes, I'm pleased to say every bit as secure as your money is in the bank. So we picked a Precision Health Cloud to store the data, and they have the same level of security in place as American banking systems and American healthcare systems in order to protect medical records. Another security thing that we've added is that information is always provided back to us de-identified. So we don't know who provided what answer to us without going back and doing special linking to get that information. And most importantly, information is never reported back to either your electronic health record or your physician. You receive your information. The other piece is it's never reported back to your employer. And we're so careful about that we don't even ask you, your employer, even when we ask you other questions about your work, what shift you work, what type of work you do, hours, those kinds of things. We don't ask you where you work. And that's because we want you to know that this is a relationship between you and us, not you and your employer, not you and anyone else. Your information is as secure as information can be with us. Reese, I'm so sorry. Your voice is not coming through.
Sorry about that, guys. I was muted. The joy of live video. So I wanted to bring in a question from the audience. Kendall Beaumont said, what is it like to take the survey? And Mike, can you address that?
Sure. Yeah, I mean, it's real simple. I mean, the way I would suggest doing it is going to the website. There's a participate tab. You select on that, create a quick login and sign the informed consent. And then from there, like I mentioned before, it takes probably about 30 minutes to complete. And the nice thing about it is if you don't have 30 minutes, you can do it in small chunks. Where you leave off, you'll be able to pick back up again. And yeah, so it's really user friendly. You can do it on your phone, computer, whatever you have access to.
Perfect. Thank you for that, Mike. Yeah, so that's one of the things we want to make sure everybody knows. It's an easy to take survey. It's not a huge time commitment. So I wanted to chat next about why Lake Nona was chosen for this study. Dr. Silverstein, can you shed some light on that?
Sure. I think Lake Nona is a perfect home for this study because it's a unique ownership structure, and I think the spirit of collaboration runs throughout. Lake Nona is really a special community, and I think part of the reason people want to join is because of special opportunities like the Life Project. I think what also is so incredible about Lake Nona is our residents, like you see with Mike and Maria. I think the study really speaks to a population like we have that's really interested in health and well-being and how to be the best version of themselves. I also think Lake Nona tends to be a really participative and engaged community, which is critical to the long-term success of a study like this, because recruiting healthy participants for research is historically not easy. So, we need the help of all of you, if you haven't done it already, to sign up and take the survey and participate.
Thank you, Dr. Silverton. And I think, I think next this question could be answered by Dr. Robinson. Will I get to see results from the survey?
And the short answer to that is yes. Yes, you will. The longer answer is eventually. So, of course, you know the answers you put into the survey. You know your own answers already. In order to provide community-level feedback or to compare you to the community, we need a groundswell of people to join the survey and to take this newest version of the survey. So the sooner we get a robust recruitment going, the sooner we can provide that information back to you, along with tips and actions that you can help change.
Outstanding. Thank you so much. And so one of the things I want to kind of address is, the results. So as we go through this, will we get to see results, not personalized, but as a community, as a whole? How could this impact health and medicine in the future? Dr. Robinson, if you don't mind addressing that one.
I think how it impacts health and wellness in the future is it is really the first study that is focused on you not getting sick in the first place. So we've started in a much younger population than a lot of longitudinal studies have started, and we're following longer. So and again, this is not a natural history where we're just watching things happen. We're stepping in and we're doing interventions either at the community or individual level that'll help us help you stay healthier longer. One example of things we can do are something called sub-studies. So when we have enough people enrolled in the main study, we can start to see trends like we did in Johnson & Johnson's first results, when we found that people in Lake Nona are more highly accomplished, but maybe think a little bit less of themselves. And that's probably why they're so highly accomplished. Have a few more inflammatory disorders than the general public. The comparison data set we compared them to, and that's also often a sign of stress. So if we notice things that trend like that, like for instance, right now sleep is the hot topic. If we notice that the majority of people in the life study aren't getting enough sleep, or even a good strong subset aren't getting enough sleep, we can throw in an intervention study that actually seeks to change that amongst that group of people. So part of participating in the life study is the ability to participate in sub-studies later that might help you and help gain scientific knowledge in general.
Outstanding. Thank you so much. And this one came in from the audience. Dr. Silverton, I think this is one that we could throw your way. How many years is the Lake Nona Life Project study?
Okay, thank you for asking that question, because I think that's a common question we get, and there's a lot of confusion around this. So the Life Project is not something where you sit down and you take it once and you're done. It's a long-term commitment over many years, maybe decades even. So if you take the survey once, that's fantastic, but you're not done. Expect that the survey is going to be at least every 2 years, and that we're also continually updating the survey, as Patricia was saying. So we're going to be adding additional segments that may get pushed out as well. So it's really an ongoing commitment and engagement.
Thank you so much. And we did have a couple of comments. I'm just going to bring these up real quick. Larry Albert said, love the project. Please sign up with the link. Thank you for chiming in, Larry. Gloria says, thank you. Proud to be involved with the Lake Nona Life Project since the beginning. Thank you for joining us, Gloria. And Marnie Brokey says, great job, everyone. So thank you all for comments. Let me go back to the champs. Mike, you've been since 2000. Was it 2016? You said 2014.
2014 was the initial meeting. Yep.
It goes quick. So what does being a champ mean to you in the day-to-day? Are there things that you've taken from what you've learned in the project in your day-to-day life?
Well, I think it is just being living, kind of being a living example of what the Lake Nona Life Project is, like trying to lead by example. But I am always looking to get more information from the study. So I am super excited about the future of the study and how all the data that's collected can help improve my life, my family's life, my friends in the neighborhood's life. So that's kind of what I'm looking for in the future, and really excited for more people to get involved so we get a bigger data set.
Thank you, Mike. And so that kind of touches on something, and that's important. And Maria, maybe I can get your input on this. What would you like to get from a study? It's obviously important to be health and well-being focused, but what would you like to see from this?
I actually would like to be able to learn what is found and seeing it being implemented, and definitely. Hopefully having people taking advantage of the results and learning from that. So that's what I hope to see from the study, that it actually does what it's meant to be and follows through. So I'm looking forward to the results.
Thank you so much. And so I wanted to kind of just bring it back to the audience, let you know that if we have any questions, we can put them in the comments below. We'll address them with the panel. But so far, we've had some great information. Here's a question that I wanted to kind of bring up. What's in it for me? And I think I'd like to hear this from the champs as well. Obviously, we want to get information out, but why is being a champion and being a part of this project important to you? Mike, if you can go first.
Sure. I think Dr. Robinson said it best. It's just learning and learning to not get sick. And so by studying this population, we can kind of get an idea and not end up in a hospital and live a healthier life, and not just live longer, but live longer and be healthy. And that's something that I strive for every day. And I'm excited, with the study to gain the insight that will help me do that.
Thank you. And then Maria, did you have any insight into sort of what's in it for you? What do you get out of this?
I think to be part of a living lab kind of thing. So you can study and analyze us on an exciting, positive way, and then that eventually it will make a difference. So we're just a living lab, and it's, a lot of people have eyes in our community, and being able to say that we were part of that study and made a difference, that's exciting to know.
Outstanding. I think that's a really good note to bring us to a close. That is all the time that we have for today. I would like to thank everybody who joined us today, and especially our panelists. I'd like to thank Dr. Silverstein, Dr. Robinson, and Mike and Maria for talking with us. You all shared a great deal of information on the Lake Nona Life Project. and how we can crack the code on lifelong health. If we didn't get to answer your question in the comments below, don't worry. Someone will review them and reply. And to find out more about the Lake Nona Life Project and how to get involved, you can visit mylakenonalifeproject.com. Thank you all for joining us, and have a great evening.
Thank you.